now we're in this second wave. And the behaviors people take on this weekend will be things that we look back at 2 weeks ago to see whether we started to shift the direction of this second wave or not. The epidemic potential, the epidemic curve is clear. The actions we take now will determine that. That's why this coming weekend, for Thanksgiving and for the weeks to come, we need people to do everything they can to prevent transmission of this virus.
Prime Minister Justin Trudeau says this country is at a tipping point, and how Canadians behave this weekend could decide whether or not we tip. So, what is the safest way to celebrate Thanksgiving over the next few days? Well, to find out, we've reached Dr. Peter Lynn, CBC News medical contributor. Thank you for being with us, Dr. Lynn.
Thanks, Catherine.
Before we get into turkey and pumpkin pie, I do want to ask about the big picture that we've been talking a lot about on the program today. We've actually spoken to a couple of different doctors, one saying that he was fearful that we were past the tipping point, and another who said she believed that we might avoid it. What is your take about how concerning the latest slate of numbers are?
Yeah, so our numbers are very high. So if you look at it, in the first wave, it's actually smaller. We've actually surpassed the first wave. And that's the typical picture of a second wave. So if you look at every single country and look back to 1918, the Spanish flu, the first wave is small because we're importing people, right? So we need people to land on an airplane, bring us the virus, or somebody driving back up, bring us the virus that way. In the second wave, what happens is that we already have people that are making the virus. So these are the healthy people, the asymptomatic people. They're churning viruses away. And as soon as we let down our guard, like let's say we're taking off our masks just to eat food together. Like, I mean, that's not reckless behavior, right? We're just having a meal. I take off my mask. I now can breathe and pass the virus to you. And that's why the second wave takes off very quickly, because as soon as we remove one barrier, then basically the virus can move because it's already within our community. And that's why that number will go up very fast. Because we have much more virus producers now than during the first wave. And that's what we're seeing, is that all the numbers are surpassing that of the spring. And if we have this many numbers sitting here, then if even 10% of that goes into the hospital, you can understand that we're worried that the hospitals will be overwhelmed. And then we're back to that, do we have enough ventilators? Do we have enough beds for all these people again? And so that's why it's a tipping point, in the sense that if you look at Europe, people are at, some of the countries are 14,000 a day, So here we are looking at 2,400 across the country. So therefore, we do have an opportunity to keep those numbers low again. And what we do actually will influence the future of the pandemic.
How reassured are you by the new measures that have been brought in? Obviously, today it's Ontario, but Quebec, too, has brought measures into its red zones and increased the number of red zones. How reassured are you?
Yeah, the thing is that they're trying to do a surgical kind of thing, right? But the problem is, if let's say Toronto is locked down, but then I can drive 15 minutes and I'm in another town where I can eat at a restaurant. So in other words, that doesn't quite work, right? Because I can actually access these other areas. And in fact, I might end up bringing viruses to those regions as well. So that becomes a difficulty. The second thing is that if we don't figure out how to open up restaurants so that you and I can have a meal together with our mask off and not pass the virus, then what happens is that 4 weeks from now, when we try to open back up again, it'll be the same thing, right? So what'll happen is we lock down, and let's say everybody behaves, the virus will go away, but then there's still those people that are making and churning this out. And then what happens 4 weeks from now, when we open things back up, you and I go out, have a restaurant, go and eat, I pass you the virus, and then the whole thing will cycle, and then we'll go into wave number 3. So that means over the next 4 weeks, what we have to do is during this lockdown is figure out, how do we do this safely so that when we open these places up, we're not going to run into the exact same thing? So do we need to have some, everybody's mask is on until food comes, and then what we do is we put a little plastic divider. I don't need the big wall. I just need it so that when I breathe across, it's not going to reach you. Or do I need to have better ventilation? Those are the things that we need to work on, as opposed to just everybody stay at home. Because I think we need to fix those things before we open back down. Otherwise, in 4 weeks, we'll open it back up, and then we'll have the third wave, which will then wipe out Christmas as well.
Yeah, and nobody wants that. This is the first time I've heard anybody actually say third wave. Oh dear. But I do want to ask you a very specific question that someone asked me, which is about patios, right? Because this is a stop on indoor dining. I think many of us, if we live in an area where there are patios, you've walked by and you've thought like, I don't know if those people are 6 feet apart. More and more now that the weather's turning, we're seeing tents sometimes put over patios. Do you think it is advisable? I should say at the same time, we understand that, businesses are trying to survive and trying to create options within the public health restrictions. Is it advisable, in your opinion, to go to a patio right now if you are in what I will call a red zone, although Ontario doesn't call it that, but one of these hot spots anywhere in the country?
Hot spots, yeah. So definitely outside is better than inside because of air circulation. So the way I want you to think about it is that if I'm carrying the virus and I make it and I'm perfectly healthy, I don't look sick, I can breathe that virus out. So think of it like a virus cloud that I could create. So that's what it means by being airborne. It can float around for a little bit. The thing is that if you and I are sitting very close, that virus cloud is going to get to you very easily. So just think about a person smoking. That's the easiest way to visualize it. So if you're sitting next to somebody smoking, you're going to breathe in that smoke pretty quick. If you're further away from me, the smoke is going to take some more time to get to you. And if we're outside, because there's airflow outside, then basically the airflow will carry the smoke away. So always think about, you're entering a room. What would happen if somebody started smoking in this room? Would I be able to smell it and do that? And if you say yes, then that means that room's ventilation is not that great. So outdoor ventilation is good. But when we look at the Rose Garden, the White House, where they had that event with the Supreme Court, all outside, right? But yet we had lots of transmission during that one event. And we think that it's during that one event because these people were sitting very close together, no masks were on, and they were talking directly face to face. Some of them were hugging. So therefore, even if you're outside, it still runs that risk. So even though you're on a patio and you're sitting, but then maybe you're very close to the next person behind you, right? So that's why we have to look at airflow and we have to look at distance. And then I would still say if you're outside, wear a mask if you can while you're chatting, and then only take the mask off when you're eating. And that increases your risk of decreases your risk of picking up the virus.
Let's talk turkey, Dr. Lynn. Thanksgiving. It seems like the message was muddier earlier in the week, and perhaps there's a bit more clarity now. But the people want to know what Dr. Peter Lynn has to say. What do you say to people about how they should celebrate this weekend? Oh, I think perhaps you don't say much. It seems like we might have lost Dr. Oh no, there you are, Dr. Lynn. Let's try that one more.
There we go.
Let's try that one more time.
The internet is very busy with all the turkeys and everything being sent over the Zoom calls. So the idea is that if you have... Hello?
We're going to give it one more kick at the can, Dr. Lynn, because I do want to hear your answer.
Okay.
But we're having some trouble with the
all
connection.
right.
Thanksgiving, what should we do?
Okay. So the people that you live with, then basically if you celebrate Thanksgiving that way, then your risk is no different this weekend than the rest of the week. If you're going to bring people in, then you have to assess their risk. Have they traveled anywhere? Do they work where they're sitting next to each other and there's no barriers and things like that? Do they wear their PPE? Like, do they take it seriously, the mask, or do they not really care? So you're assessing the person that you're bringing in terms of how risky are they. Or what we could just assume that is that they could have the virus, so let's just take the precautions. Mask on all the time, basically 6 feet apart. You can chat, you can socialize, do whatever you want. And then when it's time to eat the turkey, everybody this family sits over here, for example, or this group of friends, this bubble will sit over here. Mask can come off at that time. You can eat and then mask back on, and then you can go back to talking to each other. And then opening up the windows so that you have some new fresh air that comes in would be useful. And then think about the places, like, for example, washing dishes, where two people are standing there. That's pretty close. So those should be the same bubble people that you're using. And then finally, think about the risk of the people in your home. So if grandma is there and she's just had cancer and a heart attack and she's got diabetes, then bringing other people in might be very, very risky, because if she gets it, that becomes a difficulty. So assess the risk of the people that you're bringing into your place, and also assess the risk of the people that are in your home, that if they get sick, that would become a problem. And then it'll be very clear as to whether you should be able to do this or not. Also, the food, try to not have the same tongs that you're using. So individual things would be better. And so that would be very helpful. And then in the washroom, most important is leave the vents on. And maybe not have the towel, maybe have disposable Kleenex or paper towels, as opposed to that towel that's hanging there and everybody's hands is going there. But the most important thing is when we're talking to each other, that's when the virus is going to transmit. That is actually the highest risk there.
You're talking about paper towels. It sounds like you have thought of absolutely everything. We are just about out of time, Dr. Lynn, but I would say thank you so much for your time today, and we wish you and yours a very happy Thanksgiving.
Yes, everybody have a very safe Thanksgiving and enjoy yourself, but no viruses.
An excellent plan. Dr. Peter Lynn, CBC medical contributor.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.